This is the video for the Insulin and Antidiabetic Agents seminar for PBL 23. We were appointed case 7. The case reads as follows. Mrs. J is a 63-year-old lady who has type 2 diabetes and has had it for 20 years. She is currently on oral medications. She was admitted for severe hypoglycemia and required intravenous dextrose infusion in the hospital. She had a history of recurrent milder hypoglycemia, and at times her blood sugar went down to as low as 2.5 millimoles per liter without any symptoms. Her HbA1c was 6.5%, and after stopping dextrose infusion, her blood sugar ranges between 8 to 12 millimoles per liter. She had normal renal and liver function tests. You plan a discharge her from the hospital. The presentation will cover the following questions that were posted to us. What would be your best choice of anti-diabetic for her? What are your justifications? What are the implications of recurrent mild hypoglycemia? Our choice of anti-diabetic for the patient is metformin and sitagliptin, also known as Janumet. The following are our justifications. Metformin is a biguanide taken 2 to 3 times daily orally. Its disadvantages include gastrointestinal problems, increased risk of lactic acidosis, and increased risk of B12 deficiency with long-term use. Its cost is low. Sitagliptin is a DPP-4 inhibitor, taken once daily orally. Its disadvantages include only a modest reduction in HbA1c levels, an increased risk of pancreatitis, and an increased risk of urticaria. Its cost is also relatively high. Janumet, as a combination therapy of metformin and sitagliptin, produces an additive and synergistic effect. Metformin on its own reduces hepatic gluconeogenesis, improves insulin sensitivity, and improves GLP-1 secretion. Sitagliptin on its own increases GLP-1 levels, thus stimulating insulin secretion and inhibiting glucagon secretion. Janumet has an additive and synergistic effect and no side effect of hypoglycemia. However, it is contraindicated in patients with kidney disease, pancreatitis, and liver disease. For the implications of recurrent mild hypoglycemia, repeated severe hypoglycemia causes both significant neuronal death and cognitive impairment. Recurrent hypoglycemia that occurs over a few days to weeks may actually provide some protection during future episodes of hypoglycemia, at least in patients with type 1 diabetes. Recurrent episodes of hypoglycemia blunt the counter-regulatory hormonal response during subsequent hypoglycemia, which reduces the symptoms associated with the event and may decrease the impact on the cardiovascular system. The following are our references. Again, this has been the video for PBL 23. Thank you, and take care, Mrs. J.